Hey, welcome to the live stream. Thanks for joining in. If you have any questions, just go ahead and drop them in the chat. I'm an orthopedic surgeon. I do mostly hip and knee replacements. I work in Washington, D.C. and Maryland. And so just getting on here, gonna ask me anything and gonna answer some questions from the chat. And basically talk about what I do on a day-to-day basis. So for me, like for example, on Wednesday is my busy surgical day. I have 7 cases at my surgery center, so I'm doing 7 joint replacements, so it's a really busy day. A lot of the times I'll get 2 operating rooms, but I have a physician assistant, I have a really big staff. It's very helpful for me and helps me to do everything on a day-to-day basis. And there's a ton of people who go in the operating room and actually help with a procedure. So it's myself as a surgeon. I have a physician assistant, and I have a scrub tech. I have a circulator. There's usually an anesthesiologist. There may be an anesthesiologist assistant as well. And there's a rep usually from the company. Let's say I'm putting in a certain type of implant. I may have a representative from the company there as well, and then plus or minus maybe an x-ray tech. I was your first like. Hey, from Belgium, what's up? How's it going? Welcome to the live stream. Was your dad Ali Harb, the principal at a private school in Kuwait? No, but Harb is in Lebanese last name, so it's very common. Hey, from Russia. Wow, we have a lot of people from all over the place here. No, that's awesome that you guys are joining all the way from across the world. My goal is to really educate on medicine, on orthopedics as much as I can, and provide some information. I know a lot of the times when you get in a doctor's office, you may not always be able to get as much time as you want. So being able to do these live streams, you may get your question answered, which can be helpful. My family's also Harb. That's awesome. Yeah, Lebanese roots. There is some Harbs in Egypt as well. It's interesting because I've lived in a couple different states, and I always tend to run into a Harb somewhere. So definitely. Hey, I've been dealing with hip impingement and labrum tear. What supplements do you recommend? There's not great supplements for fixing a labrum tear. The labrum tear is just like any part of your body that's prone to injury because it doesn't have a good blood supply. So for those of you who don't know, the labrum is like the shock absorber of the hip. And if you have hip dysplasia or hip impingement, you can tear that. And that can be an issue. That can cause a lot of pain. What kind of doctor am I? I'm an orthopedic surgeon. I specialize in hips and knees. What was that? How many beers is too many beers? I can speak from a personal side and I can speak from a physician side. The AMA recommends for a male maximum of 2 drinks a day, for female maximum of 1 drink a day. And those are divided up whether it's beer, alcohol, or wine. So that's from the doctor side. From the personal side, I went to LSU, so it's a football school down there, SEC, and so sometimes there's a couple more beers in that. I feel much better after 2 months. Scared to get back into athletics. Do labrum tears heal on their own? Yes, labrum tears usually heal on their own. I would say 80-90% of the time. Thanks for all the double taps and likes and support for the channel. Labrum tears usually heal on their own with conservative therapy. It depends if the underlying issue is an impingement issue, meaning if you're having hip impingement, it may not heal as well as you want it to. And that can sometimes be an issue. In the worst case scenario, if you have a really bad labrum tear that doesn't get better, we'll go in there with a camera and a scope and clean it up. I'm 50 and I have so much pain in my hip. The question would be getting a diagnosis. If you're having a lot of pain somewhere, you want to figure out what's wrong, figure out what's going on. Exactly. And so you can get a diagnosis. The first step would be an x-ray to make sure you don't have impingement. You could get an MRI if everything fails. From St. Louis, how how long should a cortisone shot last in your knee? I would say on average, people probably get about 3 months of relief from a cortisone injection in the knee. It depends what it's being done for. There's gel injections as well, but on average, patients get about 3 months. Now, I've injected someone and maybe they got a couple days of relief versus I've injected someone and maybe they never came back to see me. So those can be very variable. I had an anterior hip replacement, 100% back to normal. That's great. That's what the best outcome you could ask for with a hip or knee replacement is 100% what we call the forgotten joint, meaning you get a joint put in and you don't have to think about it again. And that's the best thing we could ask for a joint replacement. I have an autoimmune condition. Anytime you have autoimmune conditions, it can make your joints more prone to injury. Your body actually attacks the joints. I had a hip replacement 3 months ago. I still have pain in the first few steps after standing up. 3 months is not that long. It may be that we call that get up and go pain. So if you're having get up and go pain, meaning when you get up from a seated position or you start to do some stairs, like getting up and starting or startup pain, sometimes that means that the stem hasn't fully grown in. Everyone's bone's a little bit different. Sometimes the implant we put in, and I can actually, I don't think I've pulled this one out. Let's see if I can do this one. This is the hip replacement model. So if we do a little hip dislocation action and pop that out of socket, hopefully nothing falls apart here. Let's see if this stem doesn't come out. But as you can see, there's a stem inside the bone. And so that stem can be made out of a couple different things. It can be made out of porous titanium. It can be made out of this upper part can be made out of something called titanium that's sprayed with a hydroxyapatite coating. And so that has to grow into your bone. Sometimes it can have a little collar here which can support it a little bit more. And so that part has to go back into your bone. And this is how we do a hip replacement. So whenever we are doing a hip replacement, you have your normal hip, it's in place. You basically do the surgical approach. I do what's called a direct anterior hip replacement from the front. After I go down between the muscles, I cut the neck off the femur bone, and then basically pop your hip out of socket. And then we do something called broaching, meaning we sequentially put this broach inside the bone. And that can be very helpful to get the correct size. You want to make sure there's a really snug fit in there, because if you don't have a good fit, it won't grow into the bone fully. And then after you get a good fit in the bone, we call that broaching, the process of opening up the femur for the for this implant is called broaching. And then once that's in, then we have these ceramic heads. In the United States, we're using ceramic. In other countries, they're using what's called metal heads, just because they're cheaper. Longevity, ceramic's a lot better. Ceramic on plastic is what we call it. And then on the same side, let me see if this one pops out. Oh yeah, that one pops out. So on the hip socket side, this is the cup. This is usually made out of a porous titanium or hydroxyapatite, and that basically we do what's called sequential reaming, where we make a space for it, and then once it's there, we pop it in place, and we put this plastic piece in. That's a yellow piece there, and then we basically pop the hip back together, and then you're good to go, like new, like nothing ever happened. And so that's a hip replacement. About 60% of hip replacements are intact at 60% are still intact at 30 years. What are you using for skin dressing in a total hip replacement? Let me see if I got that right. To reduce the risk of surgical site infections. So obviously, anytime we're doing a replacement, the thing we definitely want to avoid is a surgical site infection. I do things like I give certain antibiotics at the start of the procedure. I use vancomycin and Ancef, so I cover for gram-positive and gram-negative bacteria, and so that can be helpful. And then I have my patients bathe in something called Hibiclens. Hibiclens is kills all the bacteria on the skin. I give my patients something called mupirocin, meaning I give them an ointment in their nose that kills a bacteria called Staphylococcus in their nose. And then I give them antibiotics after the operation as well. And so all that is helpful to prevent infection. The actual dressing I'm doing a plastic surgery closure, meaning I'm using all my sutures are dissolvable and they go underneath the skin, and I use a skin tape and glue on top of that. So I use it's called a Prineo dressing. Hey doc, I'm a Shriner's patient with Perthes. I'm a big man now. So, what Perthes is Perthes is collapse of your hip. The Perthes is the collapse of the hip, and it leads to commonly getting a hip replacement in age kind of 30 to 60 years old. Many people with Perthes need hip replacements, and so every Perthes is not the same. Every Perthes disease may be a little bit different and different level of collapse, but a lot of the times we're doing early hip replacements for those. Hey doc, can you review my case? I've had multiple PAOs. I do telemedicine and telehealth visits. My link is in my bio. It's matthewharbmd.com/links if you want me to look at your case specifically. I had a total hip replacement, and it's years later, but I feel like it's clicking now. Hard to say what exactly is going on. My question would be, is the plastic wearing out, or is it a metal hip? Love from Germany. Hey, what's up from Germany? Yeah, if you guys have any questions, just drop them in the chat, either on YouTube or on TikTok, and I'll get to them. Currently recovering from my second Oates procedure. Sounds like they're really trying to preserve your knee. You must be young and have good cartilage. I have severe knee pain, and I went to see my ortho doc, and I need my right knee replaced. I've had my left hip replaced, and it was a breeze. What can I do to make my knee replacement a breeze? So hip replacement in general is easier to recover from than a knee replacement operation. Knee replacement operation is always more intense. Just because of the nature of the joints, there's a lot of muscle, a lot of space around your hip. There's not so much around the knee. So, and knee, you're fighting against your body, you're fighting against scar tissue, so it's a little more difficult. So I wouldn't say the knee replacement is going to be a breeze per se. Now, I have really good guides on my website that I talk about everything you should do before and after and what to expect for a knee replacement operation. It's matthewharbmd.com/links. It's in my bio. You go to my website, go to patient resources and guides, and you'll find a knee replacement guide. And there's some good exercises and things you can do to prehab your knee. What company do you use for implants or totals? DePuy, Stryker, Zimmer? I've used them all before. Right now I'm doing hip replacements with DePuy, and I'm doing knee replacements with DonJoy. But I've tried all the companies. I've had both knees replaced, and physical therapy is critical. Yes, I definitely agree with that physical therapy is incredibly important. Are exercises good for a labrum tear? Yes, exercises are good for a labrum tear. Stryker in the house. All the companies, all the implant companies have something specific about them that can be helpful and may be better for one patient than the other. So that's one of the reasons I choose which implant I do. What kind of doctor are you? I'm an orthopedic surgeon. I specialize in hip and knee replacements. I also take trauma call. I had my knees replaced 3 years ago. They're starting to hurt again. Sorry to hear that. Definitely get a checkup. Make sure nothing's wearing out. Make sure the plastic pieces aren't wearing out. Make sure nothing's coming loose. The other risk is what we call aseptic loosening, meaning that the implants, over time, there's a possibility they could come loose. Could you explain what an osseous lesion is, please? So anything osseous means bone, and lesion means it could be anything. It could be a tumor, it could be a cyst, it could be just the bone is getting less dense in that area, or you can see it on an x-ray. And so that's what we call an osseous lesion. It can mean a lot of different things. Thank you for all the double taps, all the likes, follows, shares for the stream. It really helps to grow the channel. I appreciate it. Doctor never cemented femoral component. Can he now, 30 years later? So if your femoral component was a press fit at the time and it's coming loose, then that could be an option. Take it out and do a cement it into place. Do you suggest having both knees replaced at the same time? If so, how do you get around? I usually recommend against having both knees done at the same time. I usually do one at a time, which I call a staggered operation. And if you have them done simultaneous, or we call it like bilateral knee replacements, there's a higher risk for transfusion, higher risk for stiffness after the operation, an overall higher complication rate. So that's why I tend to avoid doing both knees at the same time. Can ceramic wear away? Ceramic is very durable. Ceramic usually will not wear away. The only way ceramic would go away would be if it fractured. With newer generation ceramics, we're not seeing fracture. What tends to wear out, like if you're looking at a hip replacement here, if the pink is ceramic and the socket has this yellow liner in it, the yellow liner means it has vitamin E in it, which helps to keep longevity. And so what tends to wear out is not the ceramic per se, but this liner wears at about 0.05 millimeters a year. That's the kind of average wear rate for a polyethylene liner in a hip. And so at that rate, older polyethylenes weren't lasting as long, but newer polyethylenes have even lower wear rates because they're highly cross-linked. Is a hip replacement always necessary with hip arthritis? No, a hip replacement is an elective procedure, meaning it's when you feel like you're ready to get it done. My doctor said polyostotic fibrous dysplasia is so rare. There's only 2 cases in the United States. It is a rare diagnosis. Sometimes it can go along with other diagnoses, but very rare. Usually you need, a lot of the times you'll get like a histologic diagnosis. What is the percentage of patients who have pain after a cervical fusion? I don't have a direct statistic on that because I don't do spinal surgery at this point in my career. It depends really what they're doing it for, meaning if you have an identifiable bulge disc that's pushing on a nerve and giving you symptoms from that disc, then it can be pretty successful. I would say more often than not, if the spinal surgery is done for the right indications, then it's usually pretty successful. Ancef, bro. Yeah, I do Ancef and vancomycin for all of my joint replacements. Ancef covers all the gram-positive skin flora, and vancomycin covers all of the gram-negatives. What are your thoughts on the Zimmer G7 cup? I think the G7's a good cup. It has a lot of, it was one of the first cups that really had all the options, meaning you could switch to constrained liners, you could switch to dual mobility liners. You have nice kind of multi-hole system. There's a good longevity and track record on that cup. So Zimmer G7 is a good cup. I'm in constant pain after a right knee replacement in 2018. I'm sorry to hear that. Always good to rule out things like infection or loosening or instability. Those can all be causes of pain, especially if you've had pain for 4 or 5 years now. Can bursitis mask the need for a hip replacement in an RA osteo patient requesting an x-ray? No, because you can usually see the signs of arthritis on an x-ray, especially if you have rheumatoid arthritis. Bursitis is a complication of arthritis, but it doesn't always mask it. Now, you could get an injection in your bursa and see if it calms down, but if it doesn't calm down or you have groin pain, so people with groin pain or pain in the front of their hip is really when people tend to have bad hip arthritis. Yeah, Vanco has some coverage that Ancef doesn't. What's the best way of knowing a labrum is healed without getting... No, so an x-ray can't really show if a labrum's healed or not. I would say the best way to know if a labrum's healed is really clinical signs, meaning if you had a lot of pain in the groin and that went away, that's how we would know a labrum's healed. it's not really worth it to get another MRI to look at the labrums, see if it's healed. Now, if you still had pain or it got worse, you could always check to make sure you didn't get a worsening tear or a worse tear that you had than you had before. But we're not doing repeat MRIs to just see if it's healed. Hip is titanium. What do you prefer to use? Most of the hip replacements are titanium these days. I use a titanium stem that's porous titanium, and then one that is covered with hydroxyapatite. Do I think 36 is too young for an ankle replacement? Yes, I do think that's too young. My son was allergic to Vanco. That's a bad allergy to have. You can develop something called red man syndrome. If you're allergic to Vanco, that can cause a lot of problems. If you have any questions, just drop them in the chat. I will try and get to them. Can exercise reverse hip arthritis? No, it cannot. So arthritis is due to the thinning of the protective layer of your joint. And most of the time, that it will progress over time. So if you have arthritis, the goal is to protect the hip. Try not to let it get worse. And but the cartilage will not regrow itself or thicken up. I've done everything: injections, scopes, end-stage arthritis in my ankle. So if you're at that point where it's bothering you every day, then you have to talk about doing a fusion versus an ankle replacement. Robotics or manual? I do most of my knees manual. There's a lot of issues with the robot, meaning you need a bigger incision, or you need extra pins in the bone, you need a CT scan ahead of time. The machine is very expensive. There's no literature to actually support that results are any better than manual instrumentation. So at this time, I'm only using GPS navigation for very difficult knee replacements. Had a knee replacement in October, still not 100%. How long is recovery? Recovery is different for everyone. You know, the goal is for you to be better than you were before. You know, I see people get better even a year after their knee replacement operation. So, appreciate the follows. Thank you for all the support. I asked doctors why they decided a certain field of study. So I went into orthopedics, especially hip and knee replacement, because it's a very, you know, you see a patient who has difficulty walking or has really bad arthritis, they're crippled, and you can do a procedure on them to get them walking again. So it's a very rewarding and kind of satisfying field to be in. So I really enjoy doing hip and knee replacements. Thank you for the follow. What do I think about gel or hyaluronic acid injections? They can be helpful. I do them in my patients, especially if you failed conservative treatment with other type of medications or injections. Then a gel injection can be very good. So I will do that. Now, gel injections don't always work as well as steroids, but they you know, it's an option to try and push off a joint replacement procedure. Any new procedures for loss of meniscus? And, you know, in very young patients, we may do a meniscal transplant, but that's usually very young. And I've seen a lot of people who had meniscal transplants who went down the line, and down the line they ended up needing further operations as well. When doing a hip replacement surgery, do you cut the front or the back? I do what's called an anterior hip replacement. So I do my replacement from the front. It's a more minimally invasive procedure. I go between the muscles instead of through the muscles, and a lot of my patients go home the same day, up and walking about 15-30 minutes after about 30 minutes after the operation. 6 months after the hip replacement, still itchy and overgranulating. Sounds like you're developing some hypertrophic scar over the area. If you're having that issue, there's a really good scar cream. It's on my Amazon storefront. So if you just go to my link in the bio, it's called Biocorneum Silicone Gel. It's really good. Do I ever get nervous during surgery? No. At this point, it's like, for me, doing an operation is like tying my shoe or, you know, brushing my teeth. It's routine and second nature, and you know, you shouldn't be nervous doing surgery. If you're nervous going into surgery, then you probably shouldn't be operating. Hey, my question is, how are you doing? I know things can be intense and just wanted to check in. Good. How about you? How are you doing? Where are you from? You got some apostrophes in your name. Thanks for joining. Appreciate the support. Do you recommend arthroscopic surgery, or is open always better? It depends what it's for. Arthroscopic is kind of the newer way to fix things in the shoulder and fix things in the knee. My mom is 90 in both knees and has steroid injections 4 days ago. Should they work? Hopefully they start to kick in pretty soon. I've seen people get injected and then it may take a couple days to set in. That's not uncommon. I'm from Ireland, but living in London studying medicine. That's awesome. I'm actually going to visit Ireland in a couple weeks. So if you have any suggestions, let me know where to go. Can you remove the plate from a broken clavicle procedure done in 2015? Yes, you can. So if the issue with the plate, depending on where the plate is put on the clavicle, if you're a female, your bra strap can rub on it. It can sometimes be irritating if you have anything that presses on it. Oh, thank you for this flying super dog. You can have, if you have pressure that's on that plate, then sometimes we'll take it out. Now, if you have a hardware removal, the holes in the bone have to heal. So that can take a little while for everything to heal in after. Any thoughts on DO versus MD if you're hoping to match into orthopedics? There are some DO orthopedic surgeons that will say it's a lot more difficult coming from a DO program trying to match into an orthopedic residency. At the end of the day, we can prescribe the same things, but when you're applying on an application, because DO school is easier to get into than MD school, there has been a very big bias for super competitive specialties getting more MDs than DOs. So, it's not impossible to be a DO and match into orthopedics. There are plenty of them, but it is a bit more of a challenge, meaning you may have to have more research, you may have to have more better letters of recommendation, just a better resume to beat out the similar resume from an MD student. Yo, doc, tell me if jaw trainers are any good. I don't know a lot about jaw trainers. Sorry, it sounds like if you're trying to bite harder, I don't know. I would probably ask you could ask the dentist or someone. I had knee surgery a year ago. First month was the worst. First month is usually the worst after a knee operation. The first 2 weeks are really the most difficult. Let me try and get to some of these questions. If for some reason I don't get to your question, I have a Discord channel. People after these live streams always drop their questions in the Discord channels, and I tend to answer them offline. But there's so many questions. Let me get to a couple more of these. How common is it to have knee arthritis after conservative treatment of a minor meniscal tear? So the MRI is helpful at diagnosing arthritis of the knee, but the best diagnostic tool is actually going in there and looking directly with the camera. That way you can see everything. And so that's really the best diagnostic skill. You really don't know if you have arthritis until you look in there, you look at the cartilage directly with a scope. And if you do have it, then it sometimes can progress after meniscectomy, and it sometimes can get worse. So it depends. If you only have arthritis in one compartment, you could possibly get a partial knee replacement, but it depends on how bad your symptoms are. Knee replacement is last option, but it is an option if you're in pain every day. Should I use conditioner on my scalp? I have flakes. I don't know, maybe some head and shoulders for some flaky scalp. Let's say that may be a derm expertise area. I use conditioner. It seems like it makes things healthy, so head and shoulders is good if you have like dandruff or flakes. But not my area of expertise. You tell me. Why do we love ANSAF? Because there's a lot of studies on ANSAF. There's not so many studies on other antibiotics. ANSAF is really good for covering skin flora. So a lot of the times with open wounds, ANSAF can be a really good medication to cover all the skin bacteria. I just had to pay for my hip replacement. Well, most of the time insurance covers the hip replacement operation. You usually just have to pay your your deductible usually if you haven't met it. But that's a procedure that's usually covered by insurance, at least in the United States. Thank you for all the double taps, all the supports, all the likes for the channel. I appreciate it. Is microfracturing of the patella still being done? Of the patella, yes, it is still being done. You know, I would say patella is a more sensitive area. Microfracture is done more commonly in other parts of the knee. Hey, what's up from Chicago? Welcome to the stream. My hip replacement failed within a year 7 years ago. I'm worried a revision will increase dislocation. Anytime you have a revision surgery from a failed operation, you know, your dislocation rate can be higher. A lot of the times, if we're doing a full hip revision, we will go to what's called a dual mobility. By the way, thank you for opening my eyes to the truth in the UK. I don't know what truth that is, but I'm assuming it was probably something along the lines of that they try to delay and push off your surgery if you're young, which is not the same in the United States. If you have pain and arthritis, we get you taken care of here. How long does it take for a spinal fusion? Till your bones heal, it takes about 2 to 3 months, but I have my partners do the spinal fusions. Any ortho hip specialists you recommend in California? Depends what part of California you're in. There are a lot of good surgeons in California. English medical schools, medical students specializing in hip and knee arthroplasty would love to come to the U.S. So for, you know, my question would be, is that when you make a decision if you want to do hip and knee arthroplasty as a medical student? So for us, you know, we make a decision first to go to residency, and then from residency we make a decision to go into orthopedics, and then from orthopedics we make a decision to pursue a specialist. Had osteomyelitis twice in my spine. The second time it ate away your bone. Now you have a rod. You may need fusion, yeah, if that's the case, if your spine becomes unstable. What are the side effects of Meloxicam? Is it a whole lot better than Aleve? I like Meloxicam. It does work a little bit different than Aleve. So Meloxicam works on receptors a little differently than Aleve does. So a lot of the times we're using Meloxicam for specifically joint issues or surrounding muscle or bone issues. So it can work well. Now, that being true, I've had some people that I put on Meloxicam and it didn't work as well as Aleve for them. So everyone's a little bit sensitive to different medications. Some work better than others. If Aleve didn't work, Meloxicam is probably worth a try. How high is the risk of developing arthritis after a meniscus injury at a young age? It depends. Every meniscus injury is different. I'd say most of the time people aren't developing arthritis, but it is a risk. Surgery for Achilles tendonitis, PRP injections. PRP is very expensive. It depends how bad your Achilles tendon is. You can sometimes go in a boot with a heel lift for a while if your Achilles tendon's really bad. Sometimes in the worst case scenarios, we would take off the Achilles tendon and reattach it. Had a knee surgery in 2006 for ACL meniscus, have a hard bump on the outside of my knee. Why? I would probably say it's probably buildup of scar tissue in that area. That would be the most common reason. I had a hip avulsion. Could it happen again? Usually when you have a hip avulsion, if some of the tendons pull off, then usually that heals back pretty strongly. Thank you for the follows. Appreciate it. I had a complete shoulder replacement surgery 5 days ago. Is swelling in the hand normal? Yeah, your whole arm is going to become swollen after the operation. Do you recommend antibiotics for dental work post total knee? I usually give my patients antibiotics for about, I have them take it about 2 years for any invasive dental procedure. How about fibromyalgia and hamstring muscle spasms? Fibromyalgia is an incredibly difficult condition to treat because the pain can just be everywhere and in multiple locations in your body. Sometimes we're sending you to a rheumatologist for that, which can be helpful. There's different medications they can sometimes put you on to help. But fibromyalgia is a difficult condition to manage. How long after an open reduction internal fixation of a radius can you start lifting over, sounds like 20? Usually we want the bone to be fully healed. So usually that takes about 8 to 12 weeks. My back is protracted now because of sitting for long hours. I don't have problems keeping it straight when I want to. Should I go to a doctor? Sometimes if we see you and you're having postural issues, we can send you to physical therapy for what's called postural training. It's very common. Have you seen all the peak total knee that was in India? No, I have not. If you have a link, drop it in my Discord channel and I'll take a look at the peak total knee. My knee gives out on me and hurts a lot. Why? You may have injured some of the ligaments or the stabilizers for the knee. I have hip arthritis and a labrum tear. Never groin pain, just along the outside. Normal. It's probably bursitis if you're having pain on the outside of the hip. Any hip specialists? There are a lot of hip specialists in LA. I'm trying to think of any specific offices, but none off the top of my head. There's a group called LAOI, which is, I think, LA Orthopedic Institute. Thoughts on stem cells? They can be very, very expensive. And the literature isn't so robust to support them. I want to do my residencies in orthopedics. How did you manage to have time to work out during residency? Well, during residency, you're working really hard. Sometimes in certain rotations, you don't have time to work out. You know, you try and get in as many workouts a week as you can, and you try to stay as healthy as you can. And you know, residency in general does not lend to a healthy lifestyle. It's difficult. It's a trial by fire time in your life, and so that can make, you know, overall health of yourself not that good. And that's just how the programs are set up, unfortunately, because you have to dedicate so much time to training. Do you only serve rich people because you make more money? So I would say that's not true. You know, we are reimbursed by insurance. Many people are on, regardless of their status or wealth status. If you're over a certain age, you qualify for Medicare. Medicare is what pays the surgeons. So, you know, I see anyone with, you know, who has who's in network with the insurance or Medicare. You know, you can't run a practice and just, you know, bias the practice against people depending on their socioeconomic status. That would be impossible and malpractice. Do I like football? Yes, I love college football. I went to LSU, so, you know, I'm a big SEC fan, and I like college football more than professional, but I watch both. What are things to think about when getting a partial knee replacement at 31? I would say 31 is a pretty young age. I have a good handout, a good guide in my link in my bio for knee replacement. You could read through that. How are reimbursements looking in the years to come? Physician reimbursement is decreasing. Inflation's going up. Doctors are getting paid less and less. And hospital CEOs are getting paid more and more. So things don't look good for medicine in the future, unfortunately. Are you in Washington State? No, I'm in Washington, D.C. in Maryland. But that's a whole topic. Healthcare in the United States, I could go on for that for a long time, but that's a touchy subject. Can or should the patients do some kind of sport after a joint replacement? Yes, I have a lot of patients who do tennis, biking. Some people even run after the knee replacement, swimming, golf. So you can be very active and still do sports after hip or knee replacement. How does EDS affect the surgeries you do? EDS is Ehlers-Danlos, and it means your connective tissue is not normal. If your connective tissue is not normal, then it makes you higher risk and prone to having complications from surgery, much more than someone without EDS. So if it's full-blown EDS, it does make your complication and outcome risk not, you know, higher complication risk, lower functional outcome scores after any type of operation. But I really appreciate the support for the live stream. If I didn't get your comment, just drop it in my Discord channel. It's in my link in my bio, MatthewHarbMD.com/links. Appreciate all the support, and I'll see you guys soon.